Hello, welcome to ISMB 2024. I am Dr. Marion Adebiyi, and my poster presentation is on image-based automated diagnosis of malaria from blood smears using CNN and transformers. Malaria is a potentially fatal parasite disease spread to humans by infected female Anopheles mosquitoes through their bites. It is caused by the Plasmodium parasite and has been recognized as one of the world's most deadliest diseases for centuries. According to the World Health Organization, there were an estimated 229 million malaria cases worldwide in 2019, with an estimated 409,000 deaths, most of which occurred in sub-Saharan Africa. A timely identification and intervention for malaria plays a vital role in decreasing morbidity and mortality rate. According to the Centers for Disease Control and Prevention, the current gold standard for malaria diagnosis is a microscopy-based examination of blood smears. However, this method can be time-consuming and require trained personnel, making it difficult to scale up and reach remote areas. It's also subjective in that the test results are only as good as the laboratory where it was conducted. Hence, the goal of this study is to utilize computer vision-based approach to automate the diagnosis of malaria from blood smear images and optimize the algorithm to identify the types of malaria parasites for real-time and near real-time diagnosis of malaria from blood smear images. The methodology. The dataset utilized for this study was obtained from the repository of the National Institutes of Health's National Library of Medicine. It consists of 7,594 images of both thick and thin smears. 2,750 of them were uninfected and 4,844 were infected with P. falciparum and P. vivax malaria parasite. Convolutional neural network and vision transformer was chosen for this research, but the vision transformer will be trained in subsequent time. Figure 1 shows the framework for the convolutional neural network architecture. The model was developed and trained using the training data set. The data set, first of all, was pre-processed and split into training and testing sets of the ratio 85 for training and 15 for testing. So the model was trained using the trained data set with a 5 epoch and a byte size of 32. The results obtained. The model training process attained the final accuracy of 92.27%. In evaluating the model, the confusion matrix was used, as shown in figure 3, showing how best the model was able to identify and classify between the infected images with P. falciparum and P. vivax, and also the uninfected smears. The area under the curve quantifies the overall performance of the model in distinguishing between the classes. The area under the curve value ranges from 0 to 1, where a value close to 1 indicates better performance, as seen in figure 4, which visualizes the algorithm's performance. The classification report depicted in table 1 shows the precision, recall, and F1 scores for each class along with their average value. This is the values for accuracy The results presented in Table 1 demonstrate the algorithm's effectiveness in diagnosing malaria from blood smear images, and also showed the model's strength and weakness in classifying the selected malaria parasite infection from non-infected smears. The Vision Transformer model will be also developed and trained, and the results will be compared with that of the CNN model. Thank you for listening.